Jambo, my name is Dr. Judy Kishoya. I'm an assistant professor at Emory University, and here I work as a minimally invasive surgeon where I use imaging to do interventional radiology. I'm also a data scientist, but today my talk is to tell you about how to become a data scientist. And I'll do this by sharing my journey and how I've worked across different parts of the world and what that means for the work that I'm working on at the NIH. So my home is in Kenya, which is the eastern part of Africa. And I went to medical school at the Moi Teaching and Referral Hospital. And it turns out it was a wonderful time to be a medical student at that point, and not necessarily because of what was going on with our patients, but because I found someone who inspired me to merge this love for informatics and medicine. And this is Dr. Joe Mamlin. He had retired from Indiana University and wanted to really spend his time doing mission work, and had gone to Afghanistan, and someone told him about the opportunity in Western Kenya and would later come there and live there for, more than a decade. But Joe had a vision, which is to always lead with care. But to do that, you needed to understand other thing that was happening in Kenya at that point, which is the HIV pandemic. And this was when we had a lot of villages wiped out of their people because they got sick. And more so, they also had a lot, we didn't have enough equipment or enough medications to take care of these patients, which is a very desperate position to be in as a doctor. And we needed to figure out what was going on with them. Were they getting the medication? Were they able to remember to take their medication? What was their support system? Did they even have food? Because if everyone in the house is sick, then the children have to take care of the parents, and they may not be able to fend enough for themselves and also for the parents. And so Joe would inspire me to really focus on the wholesome care for patients and what that power meant when you were a data scientist. And we started off with putting these records in an Excel spreadsheet. Yes, you may be surprised today that you have unlimited rows when it comes to Excel. Then you had a limited number, of rows that you could enter for, and once that spreadsheet was full, you needed to open another spreadsheet. You couldn't correlate with the prior patient visit. And then we transitioned to an Access database. And so we also were scaling across multiple sites and seeing a rapid increase in the number of patients. And so we needed something better. And this really was one of the earliest times for me to see the power and the potential of data science. It turns out Joe's son, Buck, who's here, is also a doctor and a geek. Actually, Buck had destroyed one of the computers in the US and crashed one of the EMRs, the electronic medical record system used in Indianapolis. And he also is a data scientist who's also a doctor, and also Hamish and Paul are the same. They were having, lunch here during the annual meeting of the American Medical Informatics Association. By the way, that program has a high school preceptorship program that allows you to attend the annual meeting. So I hope you look it up. And they were talking about their journeys through Africa, through Kenya and Rwanda, and how they were struggling with this pandemic. And these friends would start scribbling what would be the first data model and data outlook for OpenMRS, one of the largest open source medical records system used in the world. And over the years, this is a look at 2021. We see 15 million patients have been, touched or, entered in multiple OpenMRS instances that span in over 6,000 sites. And so I learned a ton more about what it meant to be a data scientist then. And one of the examples, I don't know if you're on Twitter, you can check out Doreen Mora, who talks about, being HIV positive since 1992 and how she's living, and so but some of the lessons that I learned as a data scientist was to be very careful about just translating paperwork into the electronic medical record system. In this time, if you had a yellow card, then everyone around you would know, oh, that patient is HIV positive, or they have a sexually transmitted disease. But remember, now we find it acceptable, but then there was a lot of stigma. And so you have to think about, as a data scientist, not just in the computer ahead of you, that you're capturing this data in a way that is free of bias and does not cause harm. And even another example is about who owned mobile phones. So earlier on, not everyone could afford a mobile phone. So a mobile phone was owned by a family more than an individual. And this meant that heads of households would own the mobile phones. Now this has completely changed. Back home, my parents all have two mobile phones so that they can test which is the cheaper carrier depending on the day and what the connectivity for that is. And so, but if you have to send sensitive patient information and you're just sending it to the mobile phone, you may breach their privacy. And so you always have to remember as a data scientist that your actions have consequences. And one of the most important things is that we needed to speak in one language. I speak Swahili, I speak Kikuyu, and I speak some other local Kenyan languages. But we needed to understand if I say the patient is coughing, mgonjwa anakohoa, that those two, even if they come in different languages, can be harmonized, that they speak the same. And so I would spend some time really looking at the language of collecting medical information through this CL dictionary that is translated in over 18 languages and used around the world to capture the patient record information. But more so, what excited me mainly and has been one of the joys of being a data scientist is working with other people in the community. And I hope that you have such an opportunity, not just in Africa, but there are these type of communities even in the US. And so I would spend a lot of time talking to some of the earliest people who had worked in this community. And it turns out that when you're a data scientist, you also have to get leadership skills, because when you get the leadership skills, then you can convince people to work towards one common problem and and be motivated to figure what that problem is. And so I challenge you not to just think of yourself, oh, I'm just a data scientist, but that you're a leader and you can inspire a following to make sure that you can solve some of the toughest challenges, society challenges that we face today. So let me show you about such a different opportunity during a different pandemic, which is the Ebola pandemic, where the Médicos Sans Frontières, Google, and for volunteers from the London tech community came together to form Project Buendia. Now this, when I would show this, I would spend a lot of time explaining what these were, but now we know that all these are personal protective equipment, where you have a hazmat suit, you have an N95 mask, you have gloves, you have glasses, and you're going into these very, very hot tents if they're in Africa. And you need to be able to capture the patient information, but also get out without getting sick or contaminated, sterilize yourself, and then go on and take care of the patients again, because you can't really stay in the suits for a very long time if you're so hot. And so these were the paper records being captured. You want to make sure that you can transform this type of paper record to something like this that is easy to understand and easily accessible. And so this, amazingly relied on that common terminology that I explained beforehand, and would actually now transition to this Excel spreadsheet that could be run on any device. And I thought this was a fantastic innovation of how to make things simpler, and so that you allow, when you're in a crisis, people to focus on what matters most. And it turns out that it's not just software that data scientists have to think about. They also have to think about the hardware that is used to collect this information. These are the tablets. There was no power in the tents. And so you needed to figure out how to use just a USB charger to power the servers, and that this casing around the tablets could be easily immersed in the chlorine drapes for sterilization without having to open the device and handle it. And so when you're thinking about your data science problem, please do not think about it in isolation. And so obviously, you can see that there's a theme here around pandemics, starting from HIV, then to COVID, to Ebola, and now to COVID. And I'm working as a frontline medical doctor at that point. We had a lot of shortage of equipment and the testing. We were worried and stressed every time you went home if you're going to make the people in your house sick. We were working in new teams and new workflows. And let's look at the last 2 years. We've had amazing success with development of vaccines, and amazing success. Actually, supported by the NIH to do testing, which is what allows us to have this home test. And another technology, though, was coming in and thought that it would also have amazing success. I'll show you an example that it tells you that it doesn't, but it shows you the role of the data scientist from the vaccine development to testing and thinking about how to scale testing, and even supporting newer technologies that like artificial intelligence. And those are all the downstream uses of the data sets that you collect. And so you have to wear multiple hats and be inspired and understand multiple domains to be able to make a difference. And you also have to realize when you do not have the necessary support to be able to take care of patients or answer questions. And here's an example that most of the countries in Africa do not track, mortality statistics. And now when you have a pandemic, it's very hard to know what proportion of your population is dying and what's, how to account for them. And so some of the innovations we saw here are, for example, use of verbal autopsies, where you have a community health worker notify the authorities about deaths that occur outside the hospitals. We also saw some new innovations here, for example, using drones to look at the burial sites of people and compare them, for example, 1 year ago and this year. And you also saw people mine data from Facebook to figure out who had died. And in this, what I want to tell you is that as a data scientist, you just cannot always assume things. For example, you cannot assume that all patients who die are buried, because some are cremated. And so you have to always adapt your mind to think, how are you going to collect the data set best? I told you that I will show you an example of how this powerful technology called artificial intelligence did not really help much. And you as a data scientist have to understand that. These are pictures of chest x-rays, which we take of the chest. And the AI algorithm will just look in the dark red areas to really see, can I tell you where this this x-ray is coming from and which hospital, and is it in the ICU or this patient is from home, and then guess how what could cause this. And so we look at a place that makes a lot of AI for us. Most of the people who work in the big companies go to Stanford, and they also couldn't figure out how to use their algorithms to prioritize who's going to get vaccines before they were readily available to everyone. Another role that we really need, and we've seen data scientists play, is the role of misinformation and disinformation. Again, you understanding the data, you understanding the context it's collected and how it's going to be used, and making sure that it's not biased and has no errors, or those errors are declared and the limitations are published, because this misinformation actually can destroy life. I want to show you this picture from outside my hometown in Kenya, and we speak many languages, and you could see that we can all understand what the message is. The coronavirus, we have to wear a mask and we have to wash our hands. And so this is sort of the unifying power of not just doing data science, but communicating what you're doing to people who may not understand it. And this is what we're trying to do in Africa, where the NIH has made a big investment to harness data science for health across the East, West, North, South Africa through 7 research hubs, 7 training hubs, and 4 ethical centers coordinated around one central coordinating center. And now, if you need a little more inspiration, you can see how we're growing our virtual city, working together, discovering how will we train the next data scientists. And I hope that you're inspired, not just because you can work in Africa or any other place, but because data science is fun, and I love being a data scientist. Thank you so much for your attention. Please email me if you have any questions, and I hope that you're having a wonderful session. Thank you.